let's first discuss, well, who is who in this webinar, right? So let's start with the left side. So first, on the left side, you see Pearl, who's our founder. And she's an Oxford graduate herself. She graduated within the top 5% of her year. And she was a teacher for a really long time, actually. She worked in top London independent and grammar schools. And she helps students individually when it comes to their Oxbridge applications, but then started the Oxbridge formula and around 7 years ago. And we've been helping students with their Oxbridge applications ever since. We then have our lead tutor, Chris, who's also in charge of our critical thinking and problem solving side when it comes to medicine. He's also an Oxford graduate. Do you want to say hi, Chris?
Hi, everybody.
And yeah, so he will also be participating in this webinar as well. Then we have our lovely Grace, who's also one of our medicine tutors. Do you want to say hi, Grace?
Yeah, hi everybody. I've just started my 4th year of medicine and also at Oxford, but don't worry, the medical courses are very similar at Oxford and Cambridge, so I can hopefully provide you with insight to both of those. And I've completed the first 3 years as well as starting clinical, so I should be able to answer a lot of the questions, whether it's preclinical or clinical.
Exactly, and she has created a perfect, I would say perfect presentation for you guys. So yeah, you're in for a treat, definitely. Then we have Alec, who is a Cambridge medic, and then he will be joining us towards the end of the webinar for more towards a Q&A session. And then on the right, well, that's me. I'm a programs consultant here at the Oxbridge Formula. So if you do in the future want to work with us, or if you want to have a chat about your Oxbridge applications, then it will most likely you will be either having a chat with me or Maya, who's also joining us in the webinar as well, who's also a programs consultant. All right, so let's look at today's schedule then. So what we'll be discussing today. So first of all, we're going to discuss what's Oxbridge medicine is actually like. So what are the differences when it comes to Oxbridge medicine and non-Oxbridge medicine? So we're going to be looking at the differences when it comes to modules and overall course structure. Then we're going to be looking at the timeline when it comes to applying. So I'm sure some of you guys already know the timeline when it comes to Oxbridge medicine is a little different than when it comes to non-Oxbridge medicine. So we will be discussing that as well, especially this year. There has been some changes with BMAT as well. Then we're going to discuss, okay, medicine is hard to get in, but how hard is it to get in to Oxbridge medicine? So we will be looking at the statistics and what is, well, you guys' competition is looking like as well. Then, of course, the most important bit, we're going to discuss how you can strengthen your application. So what are the things that Oxbridge medicine will be looking for in your personal statement? What kind of admissions test preparation that you guys need to do when it comes to BMAT in particular? And then, of course, interviews. So what are interviews like in Oxbridge? And then lastly, we are going to have a Q&A session where Alec and Grace will answer all of your questions as they are our insiders, basically. So let's start with the course. Okay, so we already know the Oxbridge medicine course is different than non-Oxbridge one. So Grace, can you tell us a little bit about first medicine and then Oxbridge medicine?
Yes, so medicine at any university, but particularly Oxbridge, gives you lots of different career paths open to you. So most obviously that is becoming a doctor, but within being a doctor, there are lots of different specialities. But as well as being a doctor, there are other things you can definitely go into. All about doing medicine is being able to make decisions in a very high pressured environment. And the more I'm going through the world anyway, I realize that that is the case for most jobs you go into. So please don't see medicine as something which is going to be narrowing down your sort of options for future. Most people who do go into medicine understandably have this desire to be a doctor, but it definitely doesn't close any paths available to you. I have a lot of friends who go into research, but also go into consultancy in London. And so that's the first big selling point for medicine. And also, just in terms of what you actually learn during the course, obviously how the human body works, it's all about learning how it works so we can work out what to do when it goes wrong. There's lots of practical skills involved, so particularly in your first 3 years at Oxford and Cambridge, you will do lots of laboratory placements, you'll be working with microscopes, doing histology, and you have lots of different placements, particularly in your final 3 years. You'll go around lots of different clinical settings, from GPs to hospitals to care homes, and it's a very privileged role to be able to be a medic. I'm starting my clinical years now, and just wearing that badge, which as medical student, for some reason makes anybody and everybody tell me almost everything about their lives. And that's a very privileged position to be in. And it's a wonderful thing to, even just by talking to somebody, be able to be such a positive influence on somebody's life.
And what would you say are the benefits of Oxbridge Medicine in particular?
Well, without saying it to be very big-headed, it's known for its academic excellence. Oxford in particular is the #1 medical school in the world for the past 9 years, and that obviously comes with it some type of, well, everybody knows that it's that. So if you have that degree, and that's going to help you and open lots of doors. Cambridge is also ranked very highly, potentially the second. You're better prepared for your exams further on down the line. Oxbridge students have a much higher rate of passing their consultancy exams. So it's better, as it says down there, for specialising. So if you become a cardiac consultant or a respiratory consultant, rather than just going into being a GP. And just across the board, better job performances, whether that is within medicine or within other fields. As I said, it preps you very well to make decisions in a very high pressured environment. And because, as I'll explain a bit more later on, you do an intercalation at Oxford and Cambridge, and you get this additional BA, it's very good for going into research, and also because of being able to make those high pressure decisions, it's very good for leadership, whether that's on hospital boards or trusts, or even going into government to help create policy. And as I briefly mentioned there, and I will do a bit later, you have what I call, well, it's a compulsory intercalation. You have the choice at other universities, but at Oxford and Cambridge, you have to do it. And at first, I kind of thought, oh, you know, kind of what is the point of that? But since coming out the other side and I'm graduating on Friday, I can see the massive benefits of having this additional degree. I've, through doing a research project, have shown that I'm able to work in a lab and demonstrated lots of different skills. And that will really help me, again, if you do go into this and you realize maybe you do want to do something else other than medicine, by having that additional degree, it opens so many doors for you.
And I'm sure because of all these benefits, you kind of mentioned a little bit as well, the teaching style is also a lot different compared to non-Oxbridge medicine, right?
Yes, so you may have done some research over different medical schools, and most non-Oxbridge schools have this integrated teaching style. So that means that whilst you do have your lectures and they continue on throughout kind of 1, 2, 3, 4, and 5, you also do clinical alongside. So say in year 1, you might have 1 day a week on placement, and that builds up. So year 2, you might have 2, year 3, 3 days a week, and so on. Whereas at Oxbridge, it's practically taught separately. So I've just done 3 years of basically a science degree. I've mainly been in lectures with a few laboratory classes doing histology and different pharmacology experiments. And so that's the main difference. Then it's also how they teach. So a lot of non-Oxbridge universities can do problem-based learning. You're in small groups of maybe 10 or 15 and you get given a case. It might be a male of 55 who might be slightly overweight and he's a smoker, and then he might have cardiovascular disease, and you'd go away that week and you'd do your research on different areas you're interested in, and then you'd come back on maybe the end of the week on Friday and discuss it with your group. It's much more self-taught and independent. Whereas at Oxbridge, it's pretty much lectures. You would have, well, I had on average 10 lectures a week, and alongside that, you would have essays, which you then discuss at Cambridge, they're called supervisions, and at Oxford, they're called tutorials. And that's where sometimes it's one-on-one, but usually in groups of 2. You would sit with someone who's an expert in that field, and you would either go through the essay you've written or ask any questions you weren't sure about in the week's lectures. And it's a really good way to learn. And I think that's the one thing that really does set Oxbridge apart. The fact you do have these people who have written textbooks, who are, I've worked with somebody who's the World Health Organization's like man for neuroscience. Like, he's the person they go to, and that's insane to have such knowledge at your fingertips. And then there's a little difference in cadaveric dissection. So that's where you do a dissection of somebody who's died in order to learn the anatomy. At non-Oxbridge, it's moved away to mainly having what's called prosection. So that's where your lecturers have, if you've learned about the leg that week, they may have taken the leg and looked at that and like dissected it for you. Whereas Cambridge only, you get given the whole body and then you systematically work through that throughout the year.
Yeah, and that's definitely an exceptional opportunity, especially for a medicine student. absolutely. And I mean, you mentioned it as well, you get to work with the people who are the best in their field, which then I'm sure comes with assessment styles being a lot different than maybe potentially non-Oxbridge universities.
Yes, so multiple choice, which you will see there, is consistent across both universities. That's how all medical universities will assess you, and they're just your short answer questions that you get at the end of the year. The main difference with Oxbridge, which I'm sure if you're interested in Oxford or Oxbridge, which you all are from being on this call, you've probably heard about the dreaded essays that we get given. They sound much worse than they actually are. Believe me, I didn't do any English A level and I was completely fine. It's not like your similes or your metaphors. It's very much you have an area of biochemistry. Maybe you're writing about DNA replication and you'd write an essay on that. It is very heavy in first and second year. I had on average 3 essays a week. And it is a lot of essays, but you very much do get used to doing it. You're doing it with other people in your college, and you've got lots of resources available to you. So that's what I see the main difference between Oxford and Cambridge are compared to others, is you do have these essays. And then when you move into your clinical years, that's when you have your practical exams, which are called OSCEs. And that's what I've started prepping for, which is very weird. You have an actor and your stethoscope, and you have to listen to certain parts and perform this role play with them, as if you would when you're in the actual hospital. And then more so compared to other universities, Oxbridge have a lot of practicals and labs, which I've been referring to, and they start in first year, and you do a lot of histology. So histology is where you look at cells. And that's really important, because if somebody has a smear test, you might have to look if they've got cervical cancer. So they're really good skills to be able to learn, and they're very important for research. So I think it really does kind of put you ahead of others, being able to have those skills from day one. And a lot of other universities do coursework. We don't do very much any coursework at Oxbridge, but we do some in kind of years 1 and 2, and that's just some statistics. But don't let that scare you. I hated statistics and I was absolutely fine.
I'm sure a lot of students right now are very relieved to hear that. So let's look at the course structure a little bit more. So yeah, tell us a little bit about the course differences.
So I've started explaining this briefly beforehand, but as I mentioned, for non-Oxbridge, it's integrated, which means that you do your clinical placement simultaneously with your like learning and lectures and problem-based learning. So that's where you have clinical placements in year 1, and some universities do that differently to others. It might be you do 1 day a week, or it might be that in year 1 you have this 4-week block where they send you out into a hospital and you do a few rotations on the wards. Again, as I said, different universities do that differently. Whereas Oxford and Cambridge, you will have very little like time with patients. I think my first year was affected by COVID. I should have had slightly more than I did, but I only had 2 afternoons with patients all the way up until I started last week. So that is a massive difference. And people learn very, very differently. I really like knowing I have all the knowledge before I apply it to patients. Some people would prefer to do that hand in hand. So it really depends on you and how you learn best. And then non-Oxbridge is mostly on placement for 3rd year. The reason Oxbridge is mostly on placement for 4th year is because we have this compulsory intercalation, which I have mentioned, and it's in the row below. So an intercalation is where you actually take a year out of doing your degree. You're no longer doing medicine and you're doing the degree. So for Oxford, which I'll explain a bit more in the following slides, you have to do biomedical sciences, but you can choose within that. If you like neuroscience, you're going to specialize in neuroscience for the year. You can specialize in cardiovascular. You might specialize in space science. There are lots of things which are open to you, and you spend a whole year learning that, and you will do a dissertation like other universities do, like your history friends are doing and your English friends are doing. So that's why you start your placement on 4th year rather than 3rd year. And then in terms of your elective, this is the exciting thing everybody loves. You get to go away for 2 or 3 months to work abroad, or you can stay in this country if that's more comfortable for you. But that's available at both Oxford, Cambridge and non-Oxbridge.
And especially intercalated year, which is what we're going to discuss just now, you get to walk away with a BA, which is a fantastic opportunity, right?
Yes, 100%. And I think it's definitely important to point this out, and it is one of the reasons I chose Oxbridge, is because realistically, you all might have had 1 week of work experience before you actually commit to doing medicine. And that's all that I had. And you might even have had less than that because of COVID. And realistically, 1 week isn't definitely not enough time to expose yourself properly to healthcare. And I knew there was a very good chance that whilst I really loved my work experience, I could get 3 years down the line and actually realize, you know what, this isn't for me. And that's what I loved about Oxford and Cambridge. You can do your 3 years, you can learn about the body, which I'm sure you all love, and that's why you're here. And if you do get to those clinical years, luckily I've got to 4th year and I love it. I love being with patients, but I was aware there's a little bit of me that could not have liked that. And yet I've not wasted those 3 years at all. I can leave. I mean, I'm not going to, but I could, because I've got this BA, and it's a BA in a very good degree. And for me, it's in medical sciences with a specialism in neuroscience. I could leave from, and it's a very good degree from a very good university, and I'd be able to go and get a job just fine. So I think it's brilliant for that. And a lot of people don't make you aware of it. Everyone likes to say, oh, you're going to do medicine, you're going to go and do it for your whole life. But particularly nowadays, you might not. And that gives you a brilliant fallback. But as well as that, it also just gives you brilliant opportunities. I was very lucky to do my research project in the world's best influenza lab. I worked with the 1918 influenza, which was a brilliant opportunity. I was able to publish a dissertation, and I'm just about to be published on my first research paper in Nature. And that is absolutely incredible, and it's massive on my CV. And that really sets you apart, being, I don't know any of my friends who are at non-Oxbridge universities who've had that opportunity. And just the main thing I want to point out again is the main difference here with Oxford and Cambridge medicine is that at Cambridge, when you do your intercalation, you can choose what you do it in. If you want to do German, you can do German. I would love to have been confident enough. I mean, I wasn't able anyway, because I go to Oxford, so I have to do biomedical sciences. Most people I know at Cambridge stick with doing biomedical sciences. It's what they know, it's what they feel most comfortable with. But the brilliant thing is, if you have a passion for engineering, you can actually go and do engineering for a year, which I think is insane. And so if you are 100% thinking Oxbridge, but you're not sure which one to choose between, that would be quite a good way of choosing between them.
Yeah, I mean, Cambridge seems to give a little bit more freedom going forward. Now, I'm sure, I mean, we talked a lot about Oxbridge. Now let's discuss the timeline. So what do you guys need to do to actually get into Oxbridge Medicine? So first of all, if you're a UK student, whether it's a non-Oxbridge, whether you want to apply to non-Oxbridge Medicine or Oxbridge Medicine, you have to submit your UCAS application by October 15th. So that's just a very important date. Hope you guys are ready for that. Now, when it comes to non-Oxbridge Medicine, you have to take this exam called UCAT. So that's not unfortunately used for Oxbridge. For Oxbridge, you will need to take BMAT. Now, back in the day, by that I mean literally last year, there was a 2-sitting of BMAT. The one would take place in September, the other one would take place in November. And in order to get a place at Oxford, you would have to take the one in November. But this year, there's only one BMAT taking place, which is going to take place in October 18th. Now, let's say you conquered BMAT, you conquered UCAT. Unfortunately, when it comes to medicine, the road does not end there. So when it comes to non-Oxbridge medicine, usually interviews take place from December up until March of year 13. When it comes to Oxbridge, you will do your interview pretty much right after your BMAT, which is in December. Now, one of the perks of actually, applying to Oxbridge Medicine is that you'll also find out about your offers coming out mid-January. So potentially, even before going into interviews in other universities, you'll already know if you got a place in Oxford or Cambridge. Now, when it comes to non-Oxbridge universities, the offers usually come out between March and July of year 13. Now, let's go on to the next slide. So we also wanted to put a little bit of a timeline. So as you guys can see, you're going to submit your UCAS application mid-October. Now, until that point, I'm sure you guys are going to spend a lot of time writing your personal statement, which is also very important as well. And we will get, Grace will explain to you what Oxbridge personal statements should be like a little bit down the line in the webinar. Then, as we said, in October 18th, you will have to take the BMAT exam. And I am hoping that you guys have already started to prepare for BMAT. And so by this point, I would also assume since your summer holiday break that you're preparing for BMAT. Now, when it comes to the Oxford interviews, as we said, they usually take place in mid-December. And unfortunately, sometimes we do see students start their Oxbridge interview preparation when they get invited for an interview, which unfortunately, I would say is not necessarily the wisest choice, because what we have seen over the few years is that they can let you know around like 10 days before the interview date or 2 weeks before, which then in that case, I would argue that you're pretty much rolling the dice when it comes to your interview. So if you're very keen on Oxbridge interviews, we do recommend starting the interview preparation with BMAT preparation at the same time, because we will get into the differences between Oxbridge interviews and non-Oxbridge interviews. And as Grace just mentioned, as you can see, Oxbridge Medicine is very much a scientific degree. It comes from a very academic scientific approach. So the interviews reflect on that as well. So in order to be a competitive applicant, when it comes to the interviews as well, you do have to know a lot about sciences. So we do recommend starting the interview preparation as soon as possible, let's say. Yep, so now let's discuss how hard is it to get in. So we already know medicine itself is very, very competitive. And now I'm sure you guys can tell by the slide alone that Oxford Medicine is even more competitive. So when it comes to the UK, every year there are around 29,000 applicants, but there's only 9,500 places available. So that already shows you how narrow the chances get. It's around 30% when it comes to your success rate. That's just for medicine alone. Now, when we look at Cambridge Medicine and Oxford Medicine, as you guys can see, Cambridge has 2,000 applicants per year. Oxford has 1,890. When it comes to places, Cambridge does have a few more places available. So Cambridge has 250 places available. Oxford has 160. When it comes to success rates, Cambridge has around 12.5% and Oxford has around 8.5. Actually, Oxford used to have 9% and it fell down to 8.5. And unfortunately, we don't see that number increasing anytime soon. So it will most likely keep decreasing and it will become much more competitive in the coming years as well. And so we wanted to show you guys in a pie chart as well. So as you can see, when it comes to, if you look at the pie chart, you can see that when it comes to success rate of overall medicine, medical schools, it's much wider than Cambridge or Oxford would be as well. And then, yeah, this is just an overall application as well. So when it comes to non-Oxbridge applicants, Oxbridge applicants, already deselect themselves before applying because obviously everyone is aware how hard it is to get into, and then the expectations never stop rising once you get in as well. I'm sure Grace can attest to this as well. So it's a challenging road. So people already deselect themselves from applying, and then all of the brave ones, only a tiny proportion actually can make it in into the universities. And oh yeah, this is a great slide. So if you guys compare medicine, Oxbridge Medicine, to even other Oxbridge courses, you can see that medicine is still much more competitive. So again, Oxford Medicine has around 8.5%. If you look at biology or biological natural sciences at Oxford, it's around 17%. So that's quite a big drop. And then if you look at biomedical sciences, it's around 10%. If you look at biochemistry for Oxford, it's around 14%. And when it comes to Cambridge, medicine has 12.5%, as you guys can see. And then if you look at biological natural sciences, for example, it has 26%. That's a massive drop. And then if you look at with veterinary medicine, it is around 16%. So even within Oxford itself, medicine is very, very competitive. Now, unfortunately, the story doesn't get any prettier for international students. The process is actually a lot more competitive for the international students. So when it comes to the UK, so there's around, when it comes to international students to UK, there's around 5,210 applicants every year. Unfortunately, the places that are available is around 564. So again, that's a massive drop, which then would take your chances of success from 30% to 11%. Now, when it comes to Oxford and Cambridge, again, the story unfortunately becomes a bit more competitive. So Cambridge usually has every year 560 and Oxford has around 400 international applicants. The places they have available is only 22 and 14 respectively. So as you can see, that's basically a drop in the ocean, which then would show that your success rate for Cambridge is around 4% and for Oxford is around 3.5%. So it is definitely much more competitive compared to the domestic applicants. Yeah, so this is also another statistic that we wanted to show you guys. Grace also mentioned it as well. So the Times Higher Education has been ranking Oxford as the #1 university in the world when it comes to medicine. It's been there for the last 9 years. So that is also one of the reasons why it is competitive for not just UK, but also international students as well. So yeah, so we also wanted to show you guys in a graph. So as you can see, there's close to 4,000 applicants overall. Then that cuts down to a little bit more than 1,000 for the ones that are actually chosen to be interviewed. And then only less than 500, let's say 450 applicants are successful. And that's just for domestic students. Now, if you look at the international ones, the drop is more significant. You'll be able to see that there is more than 1,000 applicants, and then only, I would say 100 is actually interviewed. And then that even shrinks down to less than 50 for the ones that are actually successful of getting in. And then, yes, so this is just to compare the Oxbridge domestic and international success rate to another university, another reputable one, Manchester. So Manchester has around 119 international places available, which is already tripled, quadrupled the amount that Oxford has. And then, as you guys can see, there's 37% that are interviewed and 17% received offers. So what was our success rate for international students for Oxbridge alone? So for Cambridge, it was around 4%, and for Oxford, it was 3.5. So as you can see, that's a massive jump with any other university. So for Oxbridge, it does tend to be much more competitive. Now, one of the reasons why everything is getting more competitive for Oxbridge is because there has been a massive influx in applicants. So the number of applicants are increasing every single year, but the places, as you guys can see, are remaining stagnant. So they're not as increasing, they're not really representing the number of applicants as well. So in 2017, as you guys can see, there's around 1,300, let's say, applicants when it comes to Cambridge Medicine. And then in 2021, that's more than 2,000. But if you guys look at the places available or total offers, it's pretty much remained the same. It's around 250, 270, let's say. Now, the story is pretty much the same for Oxford as well. So the number of applicants are increasing every year, but the places are remaining the same, which is making everything a bit more competitive for everyone. Okay, so I'm sure everyone is aware that Oxbridge, regardless of its medicine or not, actually, they expect academic excellence from all their students. Now, when it comes to medicine, I'm sure you guys can also tell from the success rate, the excellence expectations also increase as well. So if we look at the GCSEs, when it comes to what you need, so offer holder average is usually around 10.2 A stars, which is 8 or 9s when it comes to the grades. If you're taking fewer than 10 GCSEs, then you do need 90+% when it comes to A stars. However, there's one thing that we like to point out when it comes to GCSEs. As you guys can see, so we're showing the number of A stars, which is again 8s and 9s the students have. Even if you have 10 A stars, even if you have 11 A stars, even if you have 12 A stars, that still does not guarantee you a place. As you can see, even in the 13 A stars, there's around, let's say, 10, 12 people that got A stars. They were interviewed, but no place. They didn't get a place at Oxbridge. So while it is very much important, it's not the end all as well. So when they say academic excellence, they don't just mean GCSEs. It means from A levels, GCSEs to BMAT to interviews going forward as well. Now, if we go to the next slide. Now, I'm sure everyone is also a bit worried because the pandemic got in the way and the GCSE score was kind of affected by that as well. Now, Oxford themselves have put out a statement, and they said that we will take into account the difficult circumstances in which these grades were issued when we assess your applications. Tutors will want to see how you improve your academic performance after your GCSEs, and that you do well in your A levels or other equivalent qualifications. So grades are taken always in context, but still the higher the better. So in the end, if your GCSE grades are not as good as you expected, maybe, if the pandemic got in the way, whatever got in the way of you obtaining a really good GCSEs, if you show them the academic growth that you had in your A levels and BMAT, most importantly, when it comes to medicine, then they will take that into consideration as well. Now, they do have another quote in the next slide. Yes, so for the UK students, again, this is a quote from Oxford. For UK students applying for an undergraduate course, we look at the information about the applicant's school, information about the applicant's neighborhood, and applicant's experience in the care system. So applicants from the most disadvantaged backgrounds will be strongly recommended to be shortlisted for the interview, provided that they're predicted to achieve the standard conditional offer for the course and that they perform to an appropriate standard in any required pre-interview admissions test. So this is the part that everybody needs to pay attention to. Not only you need to get really good A-level scores, but you need to show them that you are a perfect candidate for Oxbridge Medicine and BMAT at the same time. Now, let's look at the requirements for both Oxford and Cambridge. So when it comes
to say something about the GCSEs. So for last
Absolutely.
year, Oxford did not actually look at GCSEs at all. If you sat your GCSEs during the pandemic, they only looked at BMAT because they're aware that dependent on what school you went to and like with grade inflations and everything that happened with GCSEs, they will not look at it. So please do not let your GCSEs put you off. It's primarily the BMAT that has been sat. And also regarding your school and your neighbourhood, I went to a state school in Manchester and no one from my school in the history had ever gotten into medicine at Oxford or Cambridge. And I applied and I managed to get in. So if anyone's sitting there and thinking, oh, I'm not sure, I don't know whether I can do it, no one in my school has done it before, how can they help me? Please definitely do apply, and especially work with people like us who've been through it, and I've been through it myself, and you definitely can get in. I just wanted to make sure someone said that because no one ever said that to me. That yeah, you can continue now.
Absolutely. I mean, even we even have a slide dedicated to this as well. You know, in the consultation, students always hear, oh, you know, I know it's hard to get in. Should I even bother applying? And you definitely should. We will definitely talk about that later on as well. And so, yeah, absolutely. So BMAT is something that they pay a significant amount of attention to when it comes to medicine applications. And then, but in order to secure your place, you do also need to get at least 1 A star and 2 A's for Oxford, or 39 and 766 at higher level. And for Cambridge, you need to get 2 A stars and A. So the expectation increase a little bit when it comes to Cambridge, and then 40 to 42 and 776 at higher level. Now, when it comes to subjects, when it comes to Oxford, you do have to get chemistry. That's a required subject, and then you need to get either another science or maths. And then the same goes for Cambridge as well. So usually you need to get chemistry and then 1 to 2 other sciences or maths. And the subject requirements vary when it comes to Cambridge. Now, again, going back to what we just literally discussed, which is should I bother applying? And I'm sure Grace's story has already been inspiration to a lot of you guys. So you already have 4 options. So if you do pick Oxbridge, then you have 3 other options as well. I would say if you want to apply to Oxbridge Medicine, give it your 110%, because not only it will benefit you obviously for your Oxbridge application, but also doing BMAT and Oxbridge kind of interview preparation is going to significantly impact your A-level preparation as well. So I'm sure a lot of you guys are doing biology, for example. It's going to significantly impact your A-level biology as well. Now, another part about preparing for Oxbridge Medicine is that preparing for Oxbridge means you'll literally hit the ground running when it comes to any other university. So because the amount of preparation that you'll do for BMAT at interviews will already put you forward in any university's first year of undergrad. I mean, literally one of our workshops is called Medicine Bridging Course. So that should give you an idea. Now for BMAT in particular, so critical thinking skills is quite important, right? So critical thinking skills that you'll learn in the application process, which will become massively important for your undergraduate medicine as well. And most importantly, if you don't try, you won't know if you're actually able to get in or not. So for example, if Grace said, you know what, nobody has gotten into Oxford Medicine from my school, I'm probably not going to get in as well, so I'm just not going to apply for it, then she probably wouldn't be sitting here right now explaining to you, as encourage you guys to apply as well. So you have 3 other options as well, and this kind of preparation has only benefits and nothing negative about it. Right now, we do have a taster session with Grace. So yeah, Grace, take over and let us know about the personal statements.
Yeah, so I'm going to briefly, well, as thoroughly as you can in this space of time, go over personal statements. I'm sure that many of you are probably stressing over writing yours right now, or will be thinking about what you need to do in order to write it if you're applying, not this time around, but next. So writing personal statements is very difficult because, as it says there, you only have 4,000 characters, and you have to have the same personal statement for your 5 choices, your non-medical choice and your medical choices. Don't worry about your non-medical choice. I sent the exact same personal statement off to Biomedical Sciences at Leeds and I got my offer. But still with your 4 choices, and especially if you're applying to Oxbridge, you have to be very careful about making it tailored to Oxbridge and your love for science and research, but without making it so tailored that you then shut down all your other university options. So it's a very difficult thing to do, but there are definitely ways in which you can do it successfully. And I'll try and outline as many of those as I can today. But before I go into kind of the breakdown of it, it's all about why you want to do medicine, but particularly for Oxbridge, the specific aspects of science. Why do you want to come and do your 3 years of science before you want to go out into the wards? So this is very much, is there anything in science that's particularly interested you, like when you've been on work experience, when you've been volunteering, or have you had any chance to do any research in a lab? All the things I'm mentioning, you're not expected to have every single one of these. Here, EPQ is a brilliant thing to do. I didn't do an EPQ and I still got an offer. So don't think everything I say is you have to have done all of these. I was able to do some time in a lab, whereas I'm aware that many of you might not have, and that's completely fine. But you might have done an EPQ, whereas I didn't. So we're going to break down the different paragraphs, which might make it slightly more clearer. So your introduction is very important and often the most difficult thing to write. Whenever I'm doing anything, I normally actually do the introduction last, just because that's always the hardest to get started. This has to be very short, so a few lines long, literally 1 or 2 sentences. And it is why you want to do medicine. And although I've been going on about Oxbridge is, science, 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 this is the one place in the personal statement I would go down a people route. Why do you want to do science? Why do you want to do medicine? Because you love working with people. And I think this works best by an experience that you have had, and different people feel different, have different levels of comfort around being able to talk about their own experience. So I think if you click on, there's an example of what I wrote. So I felt comfortable talking about my own personal experience with my granddad, and unfortunately, he had early onset Alzheimer's at 52, which is incredibly rare. And I visited him in a care home every single Wednesday of my life from the age of 4 until he died when I was 16. And that exposed me to so much of our healthcare system. I saw him when he was in hospital. I saw him when he was in a care home. Not only did I see how the doctors dealt with him, but the nurses, the carers, and everybody he had around him. And that for me was when I realized I wanted to do medicine. And so I worded it with, it's only when something goes wrong that we appreciate our good health. I've been lucky to escape any major health issues, but my granddad was not. His battle with, which for me was early onset Alzheimer's, introduced me to our healthcare system from an early age. And I think I had one more sentence tagged on at the end about how that showed me how rewarding that was, but that's different to you. It might have been, it showed you how challenging medicine was, but how it was still very gratifying, or however that made you feel. And I think that's the best route to go down. And it doesn't have to be, mine was very unfortunate that my granddad did have such a big health event. It doesn't have to be anything, what I would say, that extreme. And it might be, and I'm sorry if you've had that exposure, but it's definitely something you can talk about. But it could be maybe a friend who's struggled at school. Obviously never give away any identifying characteristics, don't put any names in or any ages that can identify people. But even if you just say, oh, a friend had struggled with this and helping them was rewarding. So that's what I would say is a perfect thing to do. And as it says there, please don't put very cliches in. It's not, since I was 5 years old, I wanted to cure cancer, or I came out the womb wanting to study medicine, because they will just read that and throw it away. But that's my advice for the introduction. So if we go into the next paragraph, so ideally this would be your work experience paragraph. I'm aware that it might have been more difficult for some than others in actually getting in-person work experience because of the pandemic, and the universities are very aware of this. any experience that you've had in a healthcare setting. And you'll see on the next slide, we're not going to go on to it now, but that's with volunteering, and you can order these paragraphs however you like. If you haven't managed to do work experience in a GP or a hospital, that's completely okay. Talk about experience you've had with people. I mean, ideally it would be in a GP or in a hospital. I did mine working in a ward, lost the word for ward there. As it shows here, during my work experience, I witnessed a sad passing of a patient. It proved to myself I can cope with the harsh reality that not everyone can be saved. So whenever writing about anything you've done, you're not saying what you did, but what you learned from it. And I love to use ing words. I think they're the best way of being able to show what you've done, but minimize your word count. So particularly in this area, be very careful about talking about, I saw saving someone's life and it was incredible, because a lot of medicine is, you can't save somebody's life. It's about being there for someone and making their lives better. It might not be because you can make them well, but it might be because you've spoken to them and you've helped their family understand the process of what they're going through and made them feel a bit more comfortable. And as I did in mine, it's also demonstrating, it's a very fine line between roasting the NHS, because it's going through a lot of problems, and I'd be silly to lie about that. You have to show that you're aware of the pressures the NHS are facing, but that you're still willing to work in an environment that is challenging. So whether it's saying, you witnessed, unfortunately, a patient pass away, or maybe not even pass away, but you might have worked in a care home for a bit. And if you've been there a year, unfortunately, some people probably did get a bit more ill. Maybe they could walk around before, but they can't anymore. And how did that make you feel? But if you can't get a GP, or you can't work in a hospital, any work you've done with people. I worked in Sainsbury's for a year, and I talked about it a lot in my personal statement, because I saw old people, young people, rich people, poor people. Someone threw an egg at me one time on my work experience, and I put that in my personal statement, because working in A&E, you're going to have all sorts thrown at you. And I think this is what people need to realize. Like, I don't have any family in healthcare or science. I didn't have a surgeon to shadow. And if you have, brilliant, write it down, but don't let that put you off. It might be that you worked behind a bar and you've had experience with the general public. But perfect. If we go on to the next slide. So this one is about volunteering. So this is very important that you have had volunteering. Hopefully you've already been volunteering for quite a while. If not, you still have a month and a half to go. Ideally be doing sort of 2 hours a week, so you can put it into how many hours you've done in a volunteering setting. This should be working with people, ideally in a care home. I am aware that different care homes are different, have different regulations on the people they're allowing to come in. If you can't get it in a care home, can you do it with rainbows or brownies, anything which is working with people? And then you want to talk about what it's like, reflect on that experience. How did it make you feel working around all these elderly people? Has it shown you how vulnerable life really is, and the importance of talking to people and communicating with them? So if we go on to the next slide. So this is your super curricular paragraph. So this isn't extracurricular, it's super curricular, because it's something you've done outside of the curriculum, but to do with the degree, so kind of to do with medicine, or that you can link to the course. So any further research you've done, as I said, EPQs are brilliant. I didn't do one, but it's still definitely great to talk about. And you don't have to talk about it in great depth. Just did it show you that you really enjoyed research? Was there particularly something that really interested you? Someone that I know at Oxford wrote in their personal statement, they have a South Asian background, and they were really interested in why diabetes and the diabetes risk is raised. They wrote a tiny bit about that. Anything which just to show you you've gone above and beyond, and that's like, it does interest you, and it's showing the person reading it that actually this person can do 3 years of straight science. If you have, written an article, brilliant. I never had, so that's not an issue. I was lucky enough to have work experience at AstraZeneca. I wrote a little bit about, actually, I did have work experience at AstraZeneca, but this is not my example. I also had experience at Waters, which is a mass spectrometry place. Didn't write much about it. I just wrote about how I carried out a biopsy on a rat using a mass spectrometer. I understand this is an experience that not many people will have. I actually applied to natural sciences before I applied to medicine, which is why I had so much practical work experience in labs. But anything that you've done, you can even talk about a research, an experiment you've done at school, maybe even during sixth form, was the one that you really loved. Do you have like a science club at school and you've done an experiment with them? Anything that you can talk about, which is extra. If you want to talk about your A-levels, you definitely can. I wouldn't prioritize it. You should prioritize other things that you've done, because your school will be able to write you a reference, your teachers write you a reference, and they will usually focus on your A-levels and your GCSEs. So don't waste your space in your personal statement. And I think the next paragraph, the next slide. So this is your academic paragraph. So this one is a bit more flexible on what you can put in it. So it depends. If you've spoken about research in your previous paragraph, then you're not going to repeat it in this paragraph. It just depends. And it also depends on what you've spoken about before. If you've already spoken about the fact that through your work experience, you've understood the challenges of a doctor faces, the time pressure, the responsibility, then obviously do not repeat yourself. But the academic paragraph is a perfect place to talk about that if you have. If you've had the chance to interview somebody, I mean, don't make that the focus of your so when I say interview somebody, maybe you've spoken to a GP or you've been able to speak to a nurse and you've learned about their role. You can put one sentence of that in. I didn't have the opportunity to interview everybody, so I want to really stress of all the stuff I'm talking about, I didn't do myself. There's no way you can fit all of this into 4,000. I just want to make you aware of things that you definitely could talk about. Again, any research you're part of, it could be that you'll even, if your school has a biology club or a neuroscience club, and you maybe have done a poster and you presented that, that's taught you teamwork, it's taught you communication skills to be able to present it. You've probably taken knowledge which is really complex and being able to present it to people who don't understand on the same level you do, and you've had to put that into sort of simple language and draw parallels with the career you're going to go into. I drew a parallel, I think that, I mean, mine was to do with my geography A-level, so I was able to bring geography in, even though it wasn't a sort of direct science. And say doing this presentation where I had to explain complex ideas to my peers, showed that I'd be able to explain complex diagnoses to patients, because we learn all this medical jargon. If I got to a patient in the ward and tell them they're having a PE, we've got absolutely no clue what a pulmonary embolism is, and I have to put it into very simple words. Anything which you've done and you can show you've got skills that will apply to medicine, you can talk about. So next paragraph, it's just moving on to your conclusion. Again, conclusions like introductions are very difficult to talk about. This should be very short, 2 or 3 sentences. Never bring anything new into a conclusion. The conclusion is summarizing the points you put before. Something along the lines of, hopefully you can see from my experience and volunteering that I have a passion for working with people, and that I'm an organized and, obviously don't quote me on this, but you put organized, hardworking, and these attributes would allow me to flourish in an institution like yours, something along those lines. Don't bring anything new in. Don't say, oh, I've done judo since I was 5, because that shouldn't be in that paragraph. It's just summarizing. Don't list it. We don't want you to list leadership, teamwork, and communication. That won't go well. But maybe pick out your 2 key ones and say, from everything I've spoken about, hopefully you can see this and this will suit me to your university. Don't put Manchester University, Oxford University, because it's going to all 5. But that's my main tips on your personal statement.
Yes, so let's discuss UCAT a little bit too, as I'm sure a lot of you guys are also applying for universities that are, well, UCAT universities. So I'm also assuming a lot of you, if not all of you, have already said UCAT already. So hopefully your results were great. So in the UCAT exam, of course, again, you guys get to have the results immediately. You can choose where to apply and when you have your score, and weighting is done by the university. Now, when it comes to BMAT, Oxford and Cambridge, when it comes to Oxford, of course, use this. They do have cutoff scores. So we just want to give you some examples of UCAT heavy universities and BMAT heavy universities. So for example, King's College London, Sheffield, Dundee, Durham, Nottingham, they're all UCAT heavy universities. Well, for BMAT, the list is not that long. So you have Oxbridge, of course. UCL, Imperial, Brighton and Sussex, and Leeds. We do have more universities in the next slide. So yeah, just giving you a few more examples of the UCAT universities. So Exeter, for example, UEA, Leicester, Liverpool, Manchester, Newcastle, St. Andrews, Sheffield, Plymouth, etc., etc. So the list is quite crowded when it comes to UCAT. Now for BMAT, again, Oxbridge, Imperial, UCL, University of Leeds, Brighton and Sussex, Lancaster, and also Keighley. When it comes to BMAT, so in BMAT, you only get 2 hours in total. It was handwritten for 2022, so it is going to be handwritten this year too, right?
Yes, so it had changed to be an online test for the last couple of years. And then for this year, it has changed back to be handwritten. If you are, I think all of you will be taking it this year, but if you are going to be taking it next year, it may or may not be handwritten. They haven't decided. But this year it will be on paper, which can affect how you do questions because you might want to make written notes and so on. It will usually be sat at your school or at another test centre, but you can normally arrange the test via your school. And it's best to do that. It's best to notify your school as soon as possible. Jennifer, should I talk through the different sections very briefly?
Yes, that would be great.
So hopefully if you are going to be taking the BMAT, you've had a look at some papers already. If not, I'd suggest you start as soon as possible because the more practice, the better. So you have section 1, which is your thinking skills paper that you have an hour for. It's critical thinking and problem solving. So critical thinking is more qualitative. It's based on passages of text. We'll see one in a second. Problem solving is more quantitative. So there's some maths, might be like some GCSE maths questions you might have seen, and sort of problem solving in a numerical and logical context. The format has changed recently, so it's now 32 multiple choice questions per paper, every paper. In the past, you might have seen different numbers of questions, and the format was slightly different. We'll come back to the scoring in a second. Section 2, you only have half an hour for, and it's a test of scientific knowledge in all the sciences. So it's biology, chemistry, physics, and maths. You don't get any choice. You have to answer questions on all of them. And that's 27 multiple choice questions. It is based mostly on GCSE material. So if you're not taking all the sciences A level, don't worry, but you might want to go back and revise some of them if you haven't done them for a year and a bit. And then you've got section 3, which is a 30-minute essay. That's not a very long amount of time for an essay at all. It is meant to be quite short. You're meant to write a balanced argument following a prompt. So we'll kind of tell you what kind of argument you're meant to be writing. You only answer one question. Again, you don't have any choice. And the scoring is a bit different. So you get a numerical score from 0 to 5. And then also your sort of aptitude in English, in writing in English, is also scored from A to E, with A being the best. And then they calculate so they'll look at the English score, but it only really matters if it looks like you're kind of struggling to write in English. Although they will look at the individual scores, the admission choosers might look at the individual scores. The first thing they'll look at is a single weighted percentage score. You don't have to worry too much about the formula, but essentially they convert the scores from 1 to 9 to scores from 0 to 8. And then they weight the first 2 papers as a weight of 40 and the last paper as a weight of 20. So basically sections 1 and 2 are weighted twice as high as section 3. So if we look at what score you'd want to be getting in the BMAT, we'll just look at this distribution of scores. So a blue section of a bar is people who didn't get an interview, and then orange is if they were interviewed but they didn't get an offer, and then grey is they got a place or they got an offer. So the more grey in the bar, the better, essentially. And we can see that, suppose you're scoring 65 to 70, so you're in this bar, you still roughly a third of those applicants aren't even getting an interview. So you're not even getting the chance to show what you can do at interview. So really, you probably want to be scoring 70+%. that's when I talk about percentage score, I'm talking about this sort of overall combined percentage that we talked about in the previous slide. But like, if you're scoring 70% in all the sections, then that's probably a good start. It's also worth noting that even once you get to 70%, still there's a decent chunk of orange in all these bars. That's people who were interviewed but didn't get a place. And that's because your interview does also matter. So however well you do in the BMAT, you still got to get through the interview. And we can also see this is like the people who are scoring 70 plus are a small, if you add up all these bars, that's a small number of people compared to all these ones. So you do have to perform well in the BMAT to get your place at Oxford or Cambridge. So how do you prepare for this? Well, the first point is, as it says, look at past papers. There are quite a few. So you can do lots of past paper practice, although you want to do it in a sensible way. We can talk more about, we'll talk more later about how to make the most of past papers, but just sort of doing one and then forgetting about it is not really going to help you. You have to make sure you're learning from the papers as you do them. When you're practicing section 1, the key thing is really familiarity with the different question types. So there's, depending on how you break them up, like 7 kinds of critical thinking questions, 3 kinds of problem solving, but you can break them up in more fine detail than that. But you kind of need to get familiar with like what all the question words or command words are, what you have to do in each type of question. So that requires a lot of practice, but also reflecting on questions from past papers. Maybe, so we've made video solutions to illustrate exactly this kind of thing, because if you're doing the questions, but you're not thinking about what type each one is, you're not really learning from them. Section 2, there is a BMAT specification that outlines all the scientific knowledge you're meant to know. So section 2 was the maths, physics, chemistry, and biology paper. So if you cover everything on that, you should be okay, but doing past papers is also good to get a hang of the question format and the timing. I didn't say too much on the previous slides, but they are quite time pressured papers. You only have half an hour for each of sections 2 and 3, and section 1 you have an hour, but there's more questions and they take more time each. So getting used to timing is important. Finally, section 3, again, practice helps because you've got to write a whole essay in half an hour, but also sort of learning how to structure your essay quickly, how to plan what points you're going to make, and a bit of evidence for each one. That's going to help you do your planning quickly and also write more quickly. So that's something we also discuss in video solutions for BMAT essay questions.
Should we go back before we show them the question?
Oh yeah, sorry. So yeah, what I'm going to do next is I'm going to show you a paper 1 question. So it's a critical thinking question, and we'll give you, let's say, 90 seconds. Which
90 seconds, all right.
Let's say that's what you might be trying to do. So you've got an hour for 32 questions, so a bit more than 90 seconds on average, but you probably want to be doing them in the 90 seconds if you can, so you have more time for the ones that you can't do initially. So I'll show you a question, I'll give you 90 seconds, and then if you think you have an answer, it's multiple choice, so you can just pick an answer from A to E and put that in the chat, and we'll see what all of you think. So, okay, I'm going to go to the next slide. I'll start a silent timer, and then we'll stop in 90 seconds.
my timer went off.
Yeah, my timer also went off. So that's your timer. Answers in the chat if you didn't put them there already. I have a lot of Fs and then a mixture of other letters, which is interesting. So, well, I'm going to show you an example video solution, but I'll just point out while you're watching this video, how much rides on understanding what, in the context of BMAT, it means for an argument to assume something. So BMAT sometimes uses words in a specific way, and what general lessons you might be learning from the video as you watch it. This is question 15 from section 1 of the 2011. I just realized I might need to reshare with the sound improved.
Yeah.
BMAT, and this question asked which of the options could be a weakness, i.e. a flaw in the argument. So this is a flaw question, but if you peeked ahead at the options, you'd actually see it's also an assumption question because all the options are assumptions. But in any case, we need to know what the structure of the argument is and what the conclusion is so we can see what flawed assumptions were used in drawing that conclusion. So let's have a look at the passage. First, the writer says that the UK shouldn't comply with the European Court of Human Rights, the ECHR, on allowing prisoners to vote. So that's a should statement. And then they say that the ECHR defines the human rights that European countries are bound to protect. So this is just defining what the court is. In the next couple of sentences, they say that voting isn't a human right, but a constitutional right. And they say that's because it's conferred, i.e. given, by democratic states. So you could see this as partly defining these terms, but it's also kind of a moral judgment deciding what kinds of rights people have when. So I'll treat this as an opinion. It's not clear whether this is sort of a legal distinction or a semantic distinction, like something you might find in a dictionary, or whether it's kind of a distinction they're drawing because they're explaining their moral position. It might be that not everyone shares this distinction, and that's going to make sense in context because, as we'll see, basically the rest of their reasons will be factual, and so their opinion had better come in somewhere, so it seems to be here. Because if we look at the next couple of sentences, they say, voting is part of a relationship between the individual and the state, which also includes obeying the law. And maybe if you interpret relationship in a moral way, that's an opinion, but it seems more like they're just reminding us of something we already know, that both voting and obeying the law involve the individual and the state. And then they say it's proper, so that can mean it's okay, or it can mean it's something you actually should do. It's somewhere in between. But it seems in context it means something like it's right for the state to remove the right to vote from people who have broken the law. And then if we're looking for a conclusion to this passage, it's probably going to be one of these two should statements, and it seems like 7 is a reason for 1, or 1 is like a specific application of 7. So it's right for the state to remove the right to vote, and so in this particular case, the UK shouldn't do what the ECHR says, which is the opposite. So it seems that 1 is the conclusion. And then the structure of the argument is basically, well, they're saying, although human rights must be protected, voting isn't a human right, it's a constitutional right, because it's given by the state. And then they use some assumption, which is going to be flawed, and then they say, so it's, in these two sentences, they're basically saying it's right for prisoners not to have the vote. So it seems like whatever the assumption is, it's going to have something to do with the difference between constitutional and human rights. Well, as you'll see, there could be more than one assumption based on the way the question is written. But it should be related to the difference between constitution and human rights, because that's basically the meat of their argument. So this is just setting up the situation. Sentences 5 and 6 are just expanding on how the state confers or gives voting as a right, rather than it being a human right. So the main point that leads to their conclusion is that because it's a constitutional right, it's not a human right. So let's have a look at the options and see if any of them correspond to that main idea. So option 1 says that the argument assumes that human rights can be defined by individual states. Well, one reason to be suspicious of this is that it doesn't mention constitutional rights, which is the main point of the argument. But more importantly, this is just the opposite of what they're saying, because they're saying it's constitutional rights that are given by the state and as compared to human rights that aren't. So this is just the opposite of what the writer thinks, so it can't be something they're assuming. Option 2 is that the writer assumes that if something's a constitutional right, it can't also be a human right. Well, now this does relate to two kinds of rights, so it sounds plausible, so let's use the not test to see if it's actually an assumption they're relying on. So assume the opposite of this, which is what? It's that something can be a constitutional right and a human right. Well, in that case, since I've said human rights must be protected, if it's possible that something can be a constitutional right and also a human right, maybe that's possible for voting as well, in which case, even though voting is a constitutional right, which is what they've argued, it could be a human right as well, and they've already said, well, they haven't disagreed that that should be protected, in which case it's not right for them to conclude that prisoners shouldn't have the right to vote. So their argument does break down, so it seems this is a necessary assumption. But it could be that more than one of these is true, so let's check option 3, which says that the writer assumes prisoners want to be able to vote in general elections. Is that an assumption they're making? Well, actually, they talk about whether prisoners should be able to. Whether or not they actually choose to use their vote is just irrelevant. That's a completely different subject. So, as we see, it's only option 2 that's an assumption, and so that corresponds to the answer being B.
All right. I don't think I've seen a B in the chat.
We use this question because almost everyone gets it wrong, so it's a useful example to show everyone. I mean, someone asked, like, how do you do this in such a short amount of time? Obviously, the explanation here is longer than you would actually spend on the question, because ideally, once you've watched a bunch of these videos and learned from them, you'd be able to do things more quickly and intuitively. It's worth noting, like, all these symbols sort of refer to concepts you can use in breaking down an argument that you'll learn from watching a course of videos rather than just one. So after any question you do, you need to kind of reflect on, okay, why was that the answer? And obviously the video solutions are a way of helping you to do that.
I was going to say that's when our critical thinking workshops come in, where Chris explains himself how you should be handling all these questions. And then I believe now we have a section 2 question.
Yeah, I think just a picture. So this is from an explanation of the section 2 syllabus, because it is a matter of just knowing all the different material and then practicing in timed conditions. But just to show here, again, it's not just biology and chemistry and things you might associate with medicine. You do need physics knowledge as well. So you will need to go back to your GCSE or use video solutions like ours to help you revise. For instance, if you don't remember too much about electricity, you might want to go back and revise that. And then section 3, I'll just show, this is a screenshot of another sort of video resources we have on helping you make essay plans. So your question might look like, might have a prompt, like this quote. So the option of taking strike action should not be available to doctors as they have a special duty of care to their patients. And then you'll be given a task to do. Some of that's going to be arguing for something, but often there's a first part which is to explain. So here, the first part of your task is to explain what's meant by the quote, and then you'd be asked to argue for or against it, or make some related argument. And so what you need to do is then understand all the key terms as this slide will break down, and then think about how you would briefly put them into words, and then go about making your argument and think about how you'd give evidence for each key point. And so you can see that the thinking you should do is very structured, but you'll have to learn how to structure your thinking in that way when you do past papers.
So I'll hand over to Grace. So yeah, talk us through all the interview types for medicine, and also, yeah, how different is the Oxbridge Medicine interviews?
Whilst there are 3 main types of interview on this Venn diagram, there are 2 main ones that you'll come across and you've probably heard of, which is the MMI So that stands for multiple mini interviews, and it's where you have different interview stations. So you have on average 6 to 8. I had a few of them, and they're different stations. They're in either different rooms or boards around each station, and you have roughly 8 minutes per station. So one station might be a role play, and another station might be looking at an article and talking about it, and another station could be like an ethical dilemma. This is where the overlap with group interviews comes in. One of the stations might actually be you working with other applicants, and the person assessing you is looking at communication skills and how you work well with others. And then there is also panel interviews. So that's what you might think of when you think of a job interview. You might have traditionally, I think they can have up to 3 people interviewing you. Normally there's 2. So they're sat on one side of the table and you're sat on the other. And that lasts around 20 to 30 minutes. And every single Oxbridge interview is a panel interview. I believe some London universities also do panel interview, but it's 100% important for Oxbridge. So if we go on to the next slide, we're going to outline some interview differences. So as I've said, MMI is non-Oxbridge. Group interviews, you also get some at non-Oxbridge. You might not have any group interviews. It just depends on what the university feel like doing that year. And then panel interviews, as I said, some London universities, but Oxbridge are all panel interviews. It is very, very important to prep for both of them. It's unlikely you'll be applying to 4 universities that are all panel. So it's important to prep for both. But prepping for panel universities is very different for MMIs. And that's because, as it's outlined below, it's very scientific focused. It's problem solving focused. You get given knowledge you might know a little about, and you might have covered slightly in your A-level syllabuses, but they'll push you a bit further, get you to think a bit more on your feet. Again, both universities do cover medical ethics and duties of a doctor, because at the end of the day, no matter what university you go to, you're graduating with this medical degree. And whilst you do have lots of different career choices, as I did outline earlier in the talk, the majority of people who go into this career are going to become doctors. So it is really important that everybody has, the right ethics and morals to go into this field. And why this university is typical, why Oxford, why Manchester, why Birmingham. One thing I would like to outline on here is, whilst mostly there aren't role plays and like acting things at Oxbridge, from my experience and from those it's been difficult because whilst they've had online interviews in the past couple of years, it's very difficult to do a role play online. I did have a role play at my Oxford interview, and I was, well, when I say very thrown off, obviously not that thrown off because I still got in, so I must have done quite well. But in terms of, I was not expecting it. But luckily I prepped role plays because I prepped for MMIs, but I was not expecting my Oxford interviewer to say, okay, now we're going to role play, you're a GP, I'm a patient. So I just think be very aware that Oxford are, I assume Cambridge, they will very much be science focused, but they might throw in a little bit more clinical into the interviews. So next, going to focus on the Oxbridge medical interviews. So you'll be invited to, well, definitely more at Oxford. I had 4 interviews, which is a lot. So you get 2 at whatever, the way that Oxford works, and Chris might have to, so actually no, I remember this now. Oxford, you always get sent to a second college. So like I applied to Exeter and they gave me 2 interviews, and then you are randomly pulled to a second college. And I got pulled to a different college called Hughes, and I had 2 interviews there, so 4 in total. I believe that isn't always the case at Cambridge. You'll definitely get interviewed at whatever college you're at, and they may or may not pull you dependent on the numbers that year. But at Oxford, you 100% get sent to a different college. Don't look too much into this. It happens to everybody, and don't think, oh, I've been sent to Hughes, they've been sent to Peters, like why have they sent this college? It is random. And then all of these interviews, as well as it being very important that you have your science skills, at the end of the day, no matter where you go, you are going to be working with patients. Therefore, you have to show that your personality, and do you have the sort of correct skills to be able to go into this very privileged profession? Do you have the basic ethical knowledge? And we'll talk a bit more about this later, but the NHS like core pillars and their values. And in this like interview sort of situation, it is very strange, unless you've interviewed for jobs before, which likely at this stage you haven't. It is very weird to try and talk to yourself in a way that you're selling yourself, but you're not selling yourself too much. So we'll talk about how to prep for interviews a bit later on, but it's very important to get into the mindset of reflecting on things you've done. When have you worked in a team? Did you do NCS? Have you done this team project? And what did you find difficult and what were you good at? So if we go on to the next slide. I feel like a bit like Chris Whitty. Next slide. So this has a very panel style, so that, like I've been saying with Oxbridge interviews, as well as having some general why this university, what do you think about, the NHS general ethical questions. You'll get given very academic style questions. You may get given a graph and you have to interpret that, or you may get given an article. I had to come 10 minutes early to one of my interviews at Exeter to read this sheet of information, and then I had to discuss it when my interview began. And it's important to remember that the people interviewing you at that college will be the people that teach you for the first 3 years. The people who interviewed me, I still have lessons with them now. So the whole purpose of this interview is for you, it's a two-way thing. It's really important to remember is, are you gelling with the people who you're teaching with, and do you realistically think you can be taught with them for 3 years? But it's also on them, and they're thinking, can I teach this person? I said, I don't know the answer to this at least 3 times in my interview. And that's because they want somebody who will talk to them. If you don't know and you sit there like a little mouse in the corner of the room and don't say anything, you're not going to get much from the whole tutorial or supervision experience. So if I got a question, I would say, okay, so from this, I understand, X, Y, and Z. And then they might ask me a bit more about it. And I would think, well, I've learned this, so maybe this applies. And if they ask me something else, I would go, oh, I'm really sorry, but I'm not sure. Could you rephrase it? And they might rephrase it. There was this one thing that I just kept getting wrong, and I was like, oh my goodness, I keep getting it wrong. But it was fine. We just had a bit of a laugh at. They're not expecting you to get sort of everything right. So just be as you as you can. And I like to use the phrase bubbly. Be yourself, but I went in there with the mindset of, I think I can do this. And if they don't want me, that's their loss. And I know that is a very big-headed thing, but if you go in there and you think, oh, you freeze up, that's not going to do you any favors. So it's really about getting into the correct mindset. And as it says there, think aloud. And that's quite a very difficult thing to do, especially, I came from a state school and my A-level class was 40. There wasn't much opportunity I had to think aloud in class. So I really had to bug my parents and say, right, I've got this list of 50 questions, pick one and I'll speak through it with you. So the next slide outlines a few of the skills that are important to talk about. This is not only at interviews, but also in your personal statement. So we've kind of ranked them in terms of what I would say is the most important. So going from the darker ones to the lighter ones. Communication is inherently incredibly important. You're going into a patient-facing role. You have to be able to communicate with your colleagues and with your teachers and with the patients. So in an interview, they might say, literally as bluntly, can you tell me a time you've demonstrated good communication skills? So it's always good before you go in an interview to think of examples when you have. As I said earlier, I worked at Sainsbury's. I was a customer assistant manager for a year. I had to communicate with all sorts of people over gone off food and everything. And how did my communication adapt? Did I have to use quite simple language if they were, sometimes I just had to deal with little children running around, they'd lost their mum in the store, to calm them down, use very basic language which they understood. And when I was speaking to people who were elderly, I might have to lower my voice so that they could hear. Elderly people lose the top range of their hearing, and I've got a quite high-pitched voice, so I have to speak really low, which sounds weird but works. And it's different things like that, and showing people that you're aware. When have you shown listening? Have you done that in the care home? When have you done teamwork? Anything that you can think of and prep in advance for these different skills. You won't be able to cover all of these skills, and you definitely won't be able to cover all of them in your personal statement, but make sure you pick sort of 4 or 5, ideally the ones towards the top of that table. So the next slide is some advice on how to prepare for an interview. So as I've been saying throughout, list your experiences and reflect on them. Don't just say, I did this, that's no use to anybody. So you might say, from volunteering in a care home, I was able to learn the importance of communication. Maybe you've, I mean, we're still coming out the back of the pandemic, and I know some care homes, especially going into this winter, will be careful on who they can let in. And that's had a massive thing on loneliness, particularly for elderly people. Has it shown you the importance of just having a conversation with somebody? And all these different things, that's what they're looking for. Again, it's times of when you've shown your skills, when have you shown leadership? Basic knowledge and ethics of the NHS, any current views and topics in the media is incredibly important. Arguably even more important for MMIs, which I'm sure you guys will have many of. And as we'll see a bit of a timetable of sort of mock revision timetable at the end, watch BBC News all the time. I watch it every day. That might make me a bit sad. But even if you're an international, if you can access BBC News online, that would be perfect, because it is an NHS funded course, so they will be expecting you to be aware of issues that are happening within the NHS and in the UK. And then have a bit of an experience with role plays. Do that with your friends. I mean, it might sound silly, but it is really useful, and it might even be useful for your Oxbridge interviews. And just feel comfortable being able to talk about yourself. Don't go, oh, I'm brilliant because I've done this. But you need to show a little bit of confidence and be able to talk about yourself without cringing about it. And again, practice being concise, particularly for MMIs. These stations are 8 minutes long. You only have 8 minutes to say what you want and how you want to say it. So some final tips and tricks is confidence. Maybe the mindset I had, some people might see it as, I didn't think, oh, I'm cleverer than the people going into this room, everything I say is right. But like, I knew I had faith in myself, and I had to go in there and be confident with that. And I think that came across, and I was able to build up a really good rapport with the people who were interviewing me. Again, speak to those around you. I must have bugged my parents so much, but can you please test me on this question? And I'm sure any of your parents, guardians, siblings, friends will really want to help you with this. They know how challenging it is. I'll be grateful to give you a helping hand. Again, when you go into your interview, introduce yourself. They'll know your name anyway, but it's just nice to say, hi, my name is Grace. It's really nice to meet you. At the end of my interview, I think I thank them for their time, so little things like that. And it's similar to what you do with the patient. Like you will fail any of your OSCE exams if you do not introduce yourself to your patient. So have the same thing with your interviewers. Again, direct eye contact. I never ever have someone speaking to me and I'm not looking at them in the eye. And that speaks 1,000 words. The amount of people who even go here and do not look at people when they speak to them, that will give, if that's one thing you take away from today, eye contact with who you're talking to. And again, direct the question. If someone's asked you a question, speak back to them. And if you don't know, ask them to rephrase it. That's completely fine. Again, compassion, relate to your own experiences. If someone asked me, one of the things I had to read before my interviews was about this test and about false positives. And it was there's quite a big risk of false positives of prostate cancer. So I said, I can imagine that. So prostate are only within men, only men have prostate, or born male at birth. So I was like, oh, if my dad if it came back with a false positive from my dad, I'd be incredibly worried until we got the results back. So it's relating it to your own life and not showing empathy, which is really important in medicine. And again, be able to talk about why you like that university. So things I recommend to everybody is learn their course structure at a very basic level. Maybe looking at particular topics taught. Do they teach space science in year 3? And does that sound really cool? What hospitals do you do your placements in? And this is how you really tailor it to the university. If you're applying to a university in Scotland, maybe they're brilliant because they have lots of rural placements and you see a lot of different types of medicine in the countryside than you do in the city. Does your university have both of them? Do they have a specialised paediatric hospital? And again, make sure you familiarise yourself with your personal statement. And the one thing everybody says is, if you've said you've read a book, please read it and maybe even reread it the week before your interview. But that's my main advice. And then again, for Oxbridge in general, scientific enthusiasm. So this is on the next slide. Scientific enthusiasm. I applied on my year out. So it'd been a year since I'd done, well, not a year, but a few months since I'd done biology and chemistry. I just familiarized myself. I mean, I only did it a few months ago, so I didn't have to relearn it, but familiarize myself with the key concepts. And then again, like I was saying before, being able to explain difficult concepts aloud, not only is that important for the interview, but it shows that you'll be able to do it with patients in the future. if you're explaining their cancer diagnosis to them, they're not going to understand scientific words like neoantigens. You have to be able to put that into words they understand. And then also, can you contribute to a small group discussion, which I'm sure many of you are capable of doing without even needing to practice. So again, preparing for a specific Oxbridge interview, I'll go through this very quickly. It's a lot of the points we've already touched on. Ensure that you really do enjoy science and you're genuinely interested in it, because if you're not, then do not apply to Oxbridge. It is a long 3 years. I mean, looking back at it now, it's gone quickly, but when you're doing it, it is long. And if you do not enjoy doing the science, then it really isn't the place for you. Think about applying to other universities. But I'm assuming you're here, so you love the science. That's not a problem. And make sure you're comfortable in tackling science subjects. When it says to a degree level, I wouldn't have known it to a degree level, but maybe you just know it a slight bit more than you do at A level. And that's where the bridging course really comes in handy. I've helped run one of the workshops for it, and I would tackle some of the BMAT questions, but also prompt you during the session to think, and what then? What if this happened? Just push you slightly further. What I really would recommend, I've said if you take something away from this multiple times, so I guess I'd probably say if you take one thing away from this, eye contact, but also specific scientific area of research. So important. I got asked that in all of my 4 interviews. And I just decided it was going to be Alzheimer's because of my granddad's, his exposure to it, and through him, my exposure. And what I did is, even though I understood barely none of it, I read 2 scientific articles. So Nature is brilliant. Go on Nature and type in whatever your area of interest is and read it. And trust me, the first time you read it, you will know nothing. Sometimes now I read an article and I know nothing, but read it and maybe think, what are the clinical trials they're doing now? What are the new things they're doing to treat it now? And it just gives you the opportunity to show you've gone above and beyond. And also the interviewers find it interesting. I was getting interviewed by a cardiologist and I was talking to him about something to do with the brain. And he didn't know, I mean, he knew about Alzheimer's, but he didn't know the latest clinical trial I was talking about. And he was genuinely interested in what I had to say. And then it says some colleges give you the option to submit certain topics you're comfortable talking about. I've never known that to be the case, definitely not at Oxford. It could be the case at Cambridge, but I wouldn't bank on the fact you can go in and resubmit something. Be comfortable across the board. In interviews, they're not going to sit you down and ask you about this really complex physics thing, because they're not going to do that, and that would be incredibly unfair. And that would be if you're applying for natural sciences, which you're not. So it will be biology and it will be chemistry. And don't be put off with the really scary things you read online. I thought I was going to go into the interview and they were going to ask me what's the volume of oxygen particles in the room, at which point I probably would have cried. But they don't do that. It's all very fair and it's all related to what you've learned at school. So just be confident. And then if we go on to the next slide. So this is just some examples of MMI interview questions, and some of these will overlap. So it is worth still prepping these because things do overlap in the interviews, which is why prepping for Oxbridge is brilliant, because it helps you with the others. So describe a time you've had to work in a team. What is empathy and how would you define that? And then if we go on to the next slide. So this is a Oxbridge interview question. It's a question that I actually had. So a lot of you might think, oh, but surely this is veterinary. No.
Well, Grace, I just want to slow you down a sec, because we actually sent out a handout where students could have a chance to look at this. So I kind of wonder, I'd be interested to see everyone's ideas in the chat maybe. So I'll leave you to talk for 30 seconds, but I just want students to be maybe thinking about what ideas they had and writing them, just so we can have a look at what you all thought.
Yeah, 100%. So while I'm, talking to you guys, if you can pop it in the chat if you have any ideas. So I'm not looking for the name of an animal, but kind of in terms of lifestyle, how does this animal live? I won't give any more away I'll give away the answer. But I just wanted to say that this is something they could give you in your interview. I got it in my interview. This isn't a veterinary medicine question. So when it says, without telling me what animal it is, what's the lifestyle? So more, what do you think it might have eaten? And so forth. But I'll give you roughly a minute just to put a few things in the chat, and then I'll talk through what kind of things they're looking for in an interview. And don't worry if you're not sure. Again, if you are giving this in an interview and you're not sure, you're still going to have to come up with ideas, because you can't sit there and not really do anything. So I'll give you a clue. Look at the teeth. Okay, good. We've got some answers coming in. Perfect. So you've had 2 come through so far. So I'll talk through these ones, but other people might put others. So again, these are, I mean, it's difficult if you haven't seen other schools in the future, and it's easier when it's in person, you get given it because you can run your fingers along the teeth and work out if they're sharp or dull. But yes, this is a herbivore. It has flat teeth, and therefore it eats mainly plants. It doesn't really eat much meat, which you'd need very sharp teeth to rip apart. Perfect. And there's also other things you can look at. So no one's mentioned the eyes. So we've had one person. I'll give you another 30 seconds to put something in the chat about maybe the positioning of the eyes. So I've had a few people talking about the eyes now. Yeah, good. So this would be a prey rather than a predator, because the eyes are slightly further back, giving it a wider field of vision. And that's really important because it can spot whether things are running at it from all directions. So that's mainly what I wanted us to get at today from this question. And there are other things you could like pull out and notice. I think those were the main 2 that I noticed in my exam, my interview, and they were enough for me to do well enough to get in. There are other things and they might prompt you on it, but they're the 2 things I wanted to kind of pull up on.
Webinars. So we just have a little bit more go through. So yeah, I hand it over to you, Grace. And let's start with the advanced biology workshop.
Yeah, so this is just a very brief taster of what it might be like to do an advanced biology workshop on diagnostic technology and methods. We learn a lot about this at Oxbridge. As I mentioned, we do have pathology labs for different things like blood and understanding what that means. So if we click onto the first question, so if we just fire away in the chat, there are lots of different answers to this question. What can we find out from blood tests? So you've got blood group. Is there anything else we might be able to find out? There's at least 10 different things you can get from blood. Blood sugar levels, perfect. Infections, brilliant. Is there anything else? Vitamin levels, iron, got lots coming now. Blood group, acidity, so that's pH, blood cell counts, perfect. So we've covered a lot of them. Some other ones that might be more difficult, and you'll learn a lot more in these advanced work. Oh, someone said kidney function, brilliant. Don't think we'd get that one. As well as kidney, we can also work out cholesterol levels. We can work out how well our liver is functioning. So doing a simple blood test that you might get done at the GP can tell us a lot about your health. So someone's also said urea, which is perfect. So that is linked to kidney function. So if you go on to the next question, so this one, hope you won't take too long to answer. Why do we have to be careful when handling other people's blood and other bodily fluids? So why, when I've been up at the hospital today, have I had to wear gloves when I take somebody's blood? So you've got pathogens in the blood may infect, perfect. And then they might say at interview, what can you think of any particular pathogen that might spread? Can you name one that's inherently known to spread via the blood? HIV, perfect. That's the one you'd be wanting to answer. There's been a lot of stuff in the news about, unfortunately, infected blood. Yeah, other viruses, HIV is a virus, and hepatitis B and C is also quite a big one. And so if we go on to our next question. So what are the different blood types? So someone's mentioned we definitely do have blood types. Can people list the different ones we have? Perfect. So we've got most of them coming through here. And then what they could probe you and ask you is, whilst we have A, B, O, and AB, we also have positive and negative. And they could give you a article explaining the differences between positive and negative. You you don't learn about difference in positive and negative at A level, or at least I did in my AQA biology. So that's how they push you slightly further. And then you'd have to go into what's the difference between positive and negatives, and what does that mean for the patient? And they're the types of things that we do cover in these advanced biology classes. So if we go on to the fourth question, so how does the body reject blood of the wrong type? So we've already covered that we have these different blood types and they're really important. So perfect, these different blood types have antigens, but what is it in our bodies that detect the antigens and reject them? Yeah, good. So we've got the fact that the immune system, and hopefully you've learned this in biology, everything has kind of proteins on the surface, and you have different cells that go around, and if they can't fit on, it sends off a big warning system that we have this foreign thing in our body. And then we have antibodies that will then go and attack it, and lots of different cell types, and they release different things like histamine, and you get a big reaction that goes on, and that's very, very dangerous. You get systemic vasodilation, very low blood pressure, and so on and so forth. So the final question for this little bit on blood. So where is blood made in the body? And there's actually two possible answers to this. So we've got one of them coming through, the bone marrow. Can anybody get the second one? This one is a bit harder. So still, I can try and give a clue for this one, but it might not help if people don't know. So in this organ, you have white pulp and red pulp. And it's an organ that can get very big if you're ill. Spleen, perfect, well done. So that is, so the spleen does have lots of blood cells in it, but it's a place where they proliferate and you get lots of blood production. So then they might say in an interview, which I won't do now, but although these questions might seem quite basic, they will then kind of probe you on from there. So they might say, okay, so what tests would you run if this person has like iron deficiencies, or they're not transporting enough oxygen around? So if you know the spleen is an area that is detecting it, could you see whether there is a cancer of the spleen? Is a spleen enlarged? Would you scan the spleen? Would you find a particular type of a splenic marker in the blood? Is it raised? Is it lowered? These are the type of lines you need to be thinking of for your interviews. So perfect, well done everybody. If we move on to the next slide. So now we're going to go on to one of infections. And a lot of these questions, whilst they may seem basic, they came up in my interviews. So this is real level of what you'd be expected to know and be probed on. So if you go to the first question. So what are the 4 categories of things that can classically cause infection? If you pop those into the chat. So we've got we've got bacteria, viruses, fungi, and that's parasites. I think that's what we're supposed to say. Perfect. So very easy to begin with. Well done. So we have the second question. So why are elderly people more vulnerable to infection? And this is very topical. It's unfortunately why age has been a big risk factor in COVID-19, and care homes have really suffered. So we've got weakened immune system. And yes, that is definitely the correct answer, but why? Why have they got a weakened immune system? And this is what you might be asked in an exam. So yes, they may have an underlying disease, which would make them more vulnerable, but let's stick with the weak immune system. So we've got less specialized cells, lower blood cell count. Yes, but why? Why do they have less specialized cells? You're on the right lines, just need to push you a bit further. How do we make these cells? So we've got our B cells, and we've got a few of them memory cells floating around the body. So we've got cells running out of divisions. So I think you've got the right logic, just not explained in the correct way, but perfect. So what's happening is, as you get, well, your cells always proliferate. We've got this memory B cell. It's like going around to your blood, detecting, using its proteins on its surface to detect things that it's seen before. And then once it's seen before, it divides massively. And these are called plasma cells. And what happens when you get older is you just proliferate at a slower rate. So it's not running out of divisions because we don't have a set number of divisions. They just proliferate slower. Perfect. So if we go to the next question. why do we get more infections in winter? And this was an exact question that I got given in my interview. So there are a few answers to this one. So we've got more people have colds. That colds are an infection. Why do more people have colds in winter? So someone says seasonal change, which is true, but what is it about winter that causes more infections? So you've got bacteria grow more, which isn't actually the case, but good thinking. This is the question that I kept getting wrong in my interview, the one I was talking about before. So think, what is it about winter? What causes people to get infected? So think about COVID-19. What did we do to reduce infections? And why is that harder in winter? So you've got people go out more. So Christmas, what is it about Christmas then? It's not particularly Christmas, but what do we all do at Christmas? Right, we might see family, we gather, that's it, good, we're on the right lines. We all together inside, we use heating, which circulates the same air around. Perfect. So this is, if we see all collectively together, we've all got to the correct answer. So this is what you would do in an interview. You'd bounce off ideas with the people interviewing you, and then they'd help you and guide you towards the correct answer. So I think we have one more and then we'll move on. So lastly, what is the best way to prevent infection? This should be a nice, easy one to finish off with. So if you had to pick, so wear a mask is definitely one. So sanitize services. So I think I might need to word this a bit differently. So me as a healthcare professional, I'm sat there in my GP. What am I going to do to my patients to help them reduce the infections they're going to have? I think we're struggling a bit on this one. So let's think, what was the thing with vaccination, good, if I had to give it away, yes, so vaccination is the best way, and that's why we're very proud of, I'm going to fly the Oxford flag, the Oxford vaccine, because vaccination is the best way, and that's why you have massive pushes for flu jab clinics during winter, because it's brilliant at preventing infection. So perfect, hopefully that gave you a nice taste of what we'll do in these sessions. So if we move on.
Yes, so I'll just quickly read this and then we're going to go to one of the topics that we covered in our weekly medicine workshops. So when it comes to the advanced biology workshop or medicine bridging course, so one of our students have said medicine bridging course has really helped me gain confidence. As you can see, all of our sessions like this is actually very reliant on interactivity as well. So even when we don't get the questions right away in the course, the tutor always pushes us. So we still develop the right thought processes. So exactly, we're focusing on your thought processes. We're trying to change the way that you approach to these questions to begin with. Now, another one said, I love the medicine bridging course because I enjoy science and it goes into a lot more detail than at school. It adds to my motivation because it's like a sneak peek of what you would learn in a medical school. Sometimes all the steps of applying for medicine can be quite tiring, but the course helps me come back to what I really love about it and why I'm applying at all. So again, this kind of preparation is already strengthening your application overall. So now let's look at the other aspect of the interviews, which are the medical issues.
So I can run through this quite quickly because I've touched on many of these before, but these are things that you'd want to prep for both your Oxbridge and MMI interviews. So kind of like what the NHS is trying to improve on. So the 7-day NHS, vaccines, like I'd mentioned about, particularly now with COVID-19, a lot of anti-vaxxers and fake news, unfortunately, different technologies that are coming in. So the AI to read scans and robotic surgeries. What are their pros? What are their cons? Think about these things. What is evidence-based medicine? So that's where everything that you've been given or like been treated with in the medical profession has been based off evidence, whether that's a preclinical and then a clinical trial. We will only give you a drug if it's proven to work. So that's what evidence-based medicine means. Think about the junior doctor contracts. What's its pitfalls? What's changed about it recently? Why have there been strikes on it? What are the public health campaigns? COVID-19 is a huge one, but think outside of COVID-19. What else have we had? We've had eat healthy campaigns, exercise campaigns, couch to 5K, all of these different things. And then think about private healthcare. Whilst remember, even if you do have private healthcare yourself, you are going into this in the minds of the NHS. Your placements will be NHS. So think about the private healthcare. What does it have which is different? Do we think it's fair? Do we not think it's fair? And what are the pressures on the NHS? So here we've got obesity, aging population, and organ donation. And one I missed off, which is my bad, but definitely mental health. That's incredibly important and particularly heightened with the loneliness from the pandemic. So if we move on to ethical dilemmas, do give your opinion. Make sure you're not incredibly strong of everybody who doesn't have this opinion is silly or I'm 100% right. We all do have an opinion. So think of a way that you can explain it, but be wary that other people have their own opinions for their own reasons. Apply your ethical frameworks to your opinions. Why have you got that opinion? What ethical framework does it fit into? And always have examples of recent hot topics. So that's why you should always watch the news. Should we prioritize hospital beds for the unvaccinated, or should we actually say no? If you're not vaccinated, then we can't give you a bed. I mean, that will never be the case. But think about these theoretical scenarios. Should young people be given a vaccine over donating our vaccines to other countries who are less fortunate? Should we give cholesterol jabs offered on the NHS? So cholesterol is this horrible fatty. Well, we all have it. It's a fatty substance that circulates. It unfortunately blocks up your arteries and causes a lot of problems, so like heart attacks and strokes. So we go on to medical ethic frameworks. I'm sure you've all probably come across some of these. So there's Beaucamp and Childress, they're all different framework things. I haven't come across that much or didn't really use it much, but different med schools put different emphases on the frameworks that they use. There's thinking and responding as a doctor. The main ones here that you will use are the 4 pillars of medical ethics. They will come up in every single interview you have. Please learn them off by heart. So non-maleficence, beneficence, justice, and autonomy. There's lots of different, as well as talking through them with your tutors, there are lots of resources online, particularly, and always use the NHS resources. The NHS publish their own resources on all of these, and they're the best thing to use to prep for your interviews. So briefly run through some key cases and laws, and we're not just putting these on the sake of putting these on. I've just gone into my 4th year and I've had an entire week of lectures on these cases and their laws. They're incredibly relevant and they come up time and time again. So you can again read all of these and the details of them in your own time, but particularly the Hadiz Bawagaba case, which is unfortunately a medical doctor who was struck off but then reinstated. There were flaws in the NHS system and resulted in her making a fatal mistake, which unfortunately does happen, and it's important to be aware of these. And then the Charlie Gard and most recently the Archie Battersby case in terms of when to turn off life support and who should we listen to and when. Do we listen to the parent? Obviously we listen to the parents, but ultimately who makes a final decision? Is it the parents who do have legal right over their child, who's someone under the age of 18, or is it the doctors who've had all this training? And that's very important because law and ethics comes into everything we do as doctors. And all of these again are found online. So do you want me to cover this bit, Jansu, or Chris, do you want to?
So this is just to give our students an idea of what kind of expectations that we have from our students as well. So usually we ask our students to do a minimum of 5 to 6 hours of additional work per week during term time. Of course, this will be in a structured study plan, which is in the next slide actually. So to give you an idea, for example, on Monday, it will be from 5:30 to 6:30, watching maybe BBC Evening News. And then from 7 to 9, this student will attend to workshops, which will cover medical ethics. On Tuesday, from 7 to 9, they will do a BMAT 2013 mock. And then on Wednesday, from 9 to 4, they're going to have a free period. And then they'll do the marking and redo the BMAT 2013 paper. Then they're going to watch.
Can I just expand that a bit, Jency?
Yep.
So, part of the point of this is if you've just done a past paper, 2 things. Firstly, you probably didn't finish all the questions in timed conditions, or maybe you didn't have a good go at all of them. Maybe there's some you got wrong. So rather than go straight onto the solutions, you want to give yourself a chance to redo those. And after you've had a chance to basically keep going after your timed mock finished, and so you've had a good go at all the questions, then you can mark them. I'll also just note, so this student, they've set aside some time to watch the evening news. I think, Grace, that was something you you did yourself?
Yes, I mean, I always watch every day, so I find it interesting, but it's not just putting in there for the sake of it. Again, all these ethical cases, they're always on the news, they always come up, and the NHS doesn't just come up in the health section, it comes up in the headlines. If you actually ask people in the UK what makes them most proud of being a British citizen, it's the NHS time and time again. People care about it and people love it. And it's very close to people's hearts, and that's why it's always on the news. And it's very important to learn about it. And also, it's important to watch the news to be aware of different cultures. I do not follow any religion, but I have to be aware of when Ramadan is, because that's going to affect my patient's health. And if they're going to come in and have blood glucose, it's going to be really low if they haven't eaten all day, understandably. And the news gives you a really good awareness of this.
Okay, thank you. If I just talk about some of the others for a second, suppose our student has marked their BMAT paper in their free period. Obviously, that's a limited amount of time. They'd want to spend more time going through video solutions, perhaps, and also making a cheat sheet of things they learn, so they don't just forget them, something they can come back and revise. They actually can reapply those lessons in later papers. Maybe they put aside some time each week to practice particular topics, maybe something they've struggled with, they will make a note to practice it that week. So this week, maybe it's SURDS for section 2. And then perhaps they have a tuition session later in the week as well.
So let's start with the questions. So the first one is, how long are the essays? So Oxford is known for their essays. So can you tell us the difference between Oxford and Cambridge, if there is any?
I'll briefly outline my experience. You can make them as long as you want to, but it's very sensible to kind of stick within 1,500 words, because realistically, you'll have to write them by hand at the end of the year. And even writing 1,500 words, well, you have to write, for me at Oxford, 3 essays within 2 hours in first year and 3 essays within 3 hours in second year. So, I mean, if you can handwrite loads, and great for you, but my hand hurts too much after that. So I try and stick to 1,500. Obviously, if you are writing this topic and you particularly love it, I did once write an essay of 3,000 words, which was very excessive. But it's kind of around the 1,500 to 2,000 mark.
Is that the same story for Cambridge?
Yeah, so pretty much in the exam, yeah, stick to about 1,500. I think when it comes to essays for supervisions or tutorials, then it can be far more relaxed and you can do more, like Grace was saying, or if you've just got less to say that week, then you can go around 1,000 words or something. But yeah, for the exam, 1,500.
Now, the next question is, would you say it's hard switching back to medicine after the intercalated year?
For me personally, no, because your whole year does it. So it's not like you're taking a step out of your cohort, they all move on and you don't. You don't even really, especially Oxford, and you probably didn't experience, Alec, but we all do biomedical sciences. So we all do the same degree, whilst we might do different specializations. So I did neuroscience, so I didn't have lectures with some of my cohort for the whole year. But you all choose your different options here and there. But you all sit the same, well, not the same, like it's the same finals, but I had different questions because I'm in neuroscience, but your timeline is exactly the same. So I didn't feel like I was actually doing anything different than medicine at all.
I think it definitely, yeah, I would agree with that for sure, but it definitely depends what you do for your intercalation. So if you stay with something that's very much to do with medicine, like neuroscience, it probably feels like slightly less of a difference. I did anthropology and as like a major subject, and then we also have the chance to do a minor one, which I did on clinical ethics. And the switch from anthropology back to medicine was quite odd, but it's less that change feels quite unusual. It's more that then you're starting 4th year and finally you're seeing patients, and you're not just saying lecture theatres all day, and it's that change actually that's more noticeable than the change from intercalation.
Perfect. And this next question is, what are the requirements to get into Oxford? So when it comes to A-levels, as we discussed previously, it will be 1A star 2As, and for Cambridge, it would be 2A star 1As. Now, the next question is, how much does Oxford look at GCSEs when offering medicine places? What would you say, Grace?
So last year, they didn't look at them at all, because of the whole, no one actually sat GCSEs. They were all kind of, done by your school, and they were more predicted. in a normal year where you did sit your GCSEs in person, GCSEs are weighted very heavily. So whilst you have to have your predicted grades to even get considered to have an offer, they then work out whether you get an offer to interview. So you have to get past the first hurdle. Have you got A*A predicted? Yes. Right, then how do we rank you? 50% of that comes off your BMAT score and 50% of it comes off your GCSE. But I don't know when you sat these GCSEs. If you actually did not sit them in person, then they will not look at your GCSEs at all. And when I say not look at them at all, if you were if you were ranked a 0 to 9 and you got 0 in all of them, which I'm sure you did not do, then that's a different matter. But if you did not get 10, 8s or 9s, I would not worry.
Very good to hear. Oh.
It's also worth adding, just as we touched on before, they're not saying like everyone's going to get 10 or whatever. You're being compared against the expected number of GCSEs for someone in your local area and studying at your school.
And actually, this next question is as well, I was going to hand it over to Chris. So the student says, I'm a gap year student who has achieved 2 A stars and an A and wants to apply to Oxford. Am I at a disadvantage compared to someone with higher grades or who has not taken a gap year?
Firstly, if you have 2 A stars and an A, I don't think you're at a disadvantage compared to anybody. That's the offer. Well, it's more than the offer you need for Oxford. That's completely fine. I don't know what subjects they're in, but I assume they're sensible subjects. Is there a disadvantage from taking a gap year? For medicine, I understand, usually not if you spend it in a productive and reasonable way. Grace and Alec, would you agree with that?
This is me. I had A star, and I had a gap year. This person has described me. And it had it depends on why you took a gap year. If you took a gap year because you had to resit your exams, that is a bit different. Whilst you have the grades now, they may ask you why you struggled to get them first time round. If you had a gap year just because you wanted a gap year, there is no problem. You can link anything to being relevant for medicine. I mean, working in a care home or a medical field is more relevant, but to be fair, you could probably track around the world and say, you know, it's relevant. I learned about different cultures. I worked for a year at Sainsbury's, but then again, when you say you take a gap year, you actually apply you finish school in August, well, not August, like July or whatever. You then apply in October and you have your interview in December. So when they interview you, you've actually only had like 4 months off. I've never known it to disadvantage anybody. It might be more difficult because you get less support from your school. So it could be a disadvantage in that respect, but Oxford and Cambridge will not look at you and go, this person's a gap year student, therefore I don't like them as much as someone who's straight out of school. So don't let it bother you.
Really good to hear that.
I would just add you might find your interview is slightly different because obviously you'll have done your full A levels already. They might ask you about what you're doing on your gap year. So you do have to bear that in mind.
Absolutely. Now, the next one is what BMAT score should we aim for, which, as we said, you should be aiming above 70, just to be on the safe side. But of course, the higher, the better, always. Now, the next question is...
So we could put that into standardized scores, maybe, because people might be seeing those. So
oh, yeah.
I think, like, let's say 6.5 plus as a standardized score in papers 1 and 2 is quite nice.
My highest was 6.2. I think I got 6.0 and 6.2 and a 5A. And weirdly, that was the highest score of my cohort at Exeter. So like, whilst you aim as high as you can, and if you have a 6.5 and above, you will basically get invited to interview. But I mean, you have no choice anyway, because you get your score after you've applied. So like, once you've applied, it doesn't really matter, like you've done it now. But like in your practice, when I got my score back and I realized, oh my goodness, I only have a 6.0 and a 6.2, I was like never going to get invited to interviews. And when I arrived and I asked around the other people interviewing, that was considered a high score. So whilst you can look at the stats, and obviously if you do, more people with a higher score might get in, there's still people who will be offered to interview with scores that might have 5.8 and 5.9. And remember, once you get to interview, it's how you perform an interview. So I must have just been quite a good interviewer and that helped me, but please don't go in with a really negative mindset that I have this score, I'm not going to get this grade, because once you've got the score, there's nothing you can do about it. You have to focus on the next step.
I will just say that when you're doing past papers, you probably want to aim higher because you don't know the difficulty of each paper. You want to be getting like consistent high scores so that if it happens to be that the paper you get is a harder one, then you're still sort of on track.
And the next question is, does going to a state school or selective school or even private affect your chances of getting an offer?
So statistically, it shouldn't really. Colleges and the uni as a whole definitely have a demographic that they need to fill, and they have certain amounts of state school pupils and also overseas pupils that they need to make sure that they give offers to every year. That's different for each college, and they don't really like make the actual number well known, as far as I'm aware. In terms of how like the teaching would affect you, I mean, it's well understood that going to a private school, you're probably going to get better teaching, and it's going to be more personalized. But as someone who came from a state school background entirely, I do strongly believe if you have the motivation and it's really what you want to do, then you'll be able to put in enough work and you know, practice enough, learn enough to be as good, if not better candidate than another private school candidate. So
All right, so the next question that we have is, what if a student got low GCSE grades and did a full year resit for all the subjects again? If the student gets very good grades in the resit, will that affect the application at Oxbridge, or will the student get rejected because they did a resit? Chris, I'm going to pass this on to you.
Well, it probably does depend a lot on the individual student's situation. What they would want to see is that your improvement was due to you showing your actual academic potential, and then that improvement continues into your A levels. So you would probably want to first explain why you think that the first time you sat them, it didn't reflect your actual ability, how you sort of rectified that. And then they'd want evidence from you and your teachers, I suppose, that continues to A level. It's definitely not like you'll get straight away rejected, but you kind of have something to explain. It's a bit awkward as well, because obviously, like with COVID, like GCSE grades have been a bit less directly connected to your actual performance. So I don't know how the university will take it. It depends on your exact situation.
Now, somebody says, I imagine excellence in arts, for example, practicing a music instrument at advanced level would have a positive effect on Oxbridge Medicine applications. What would you guys say to that?
Definitely not a bad thing. It's something you can talk about in your personal statement. It's shown dedication and other stuff that you've done. But again, it's not necessary. I don't play a musical instrument, let alone to an advanced level. So don't get like, if you're still on this Q&A and you're like, oh, I don't play clarinet to like grade 8. I don't. It's just something that you can put in, and like it is a good thing to talk about at interviews. I got asked at one of my interviews, what can you contribute to this college? And I just said I joined the badminton team. And you can say that you play advanced clarinet for them or whatever you play. So it's definitely a good thing, but it's not a necessary thing.
Now, we did say...
Can I just ask you, had you sort of researched the college and found out they had a badminton court, for instance?
Oh yeah, definitely. I knew the name of their badminton team. So this is where you be clever. Like I'd looked up all I only knew I was interviewing at Hughes the day before I interviewed. I spent that night being like, okay, what is their like sports team that I can join? And I do play badminton, so it wasn't a lie. I do play badminton. I just wanted the detail of what their name was, because it's making it specific to them.
But I want to just highlight that they don't really care about having like a good sports team. Like they don't care if you're good at badminton. What they care is that you put the effort into learning about the college.
We did talk about Oxbridge doing multiple interviews. So Alec, one of our students asked, what is the difference between the 2 interviews in the same college?
Yes, so Cambridge don't do interviews at different colleges like Oxford does. So it's just the 2 at your one college. They're largely not different in terms of the content. Both will be with just 2 interviewers and yourself in a room, usually like sat around the table. And I'm not sure about how like far apart the interviews are in Oxford, but in Cambridge, you'll maybe only have an hour between the 2, and then you're done and you can go home. So they do, I think they kind of claim that one interview is going to focus more around your personal statement, and maybe things you've included in there, and another one's going to be more science-based. But in practice, it doesn't really end up happening. There will be one where they mention something on your personal statement, but it's kind of like, once they've done that question, that's ticked off for them, and they'll go straight back to science. So yeah, it's all just broadly the same.
How about for Oxford, Grace?
Yeah, very much the same. My experience was one was more ethicy and kind of like you get science in both of them fundamentally, but one was more graphs. I had a lot of graphs, and that's what they were concerned about. And the other one had a bit of was the one with the role play, but also kind of a bit more ethicy and diseases of aging, that type of orientated. But again, you have like an hour between them. Your experience at Oxford can be a lot longer. I was lucky, I was only here for 24 hours. Some people can be here for up to a week because you wait to get pulled. So it's a lot more different to Cambridge. And again, I didn't know what the badminton team was at Hughes because I didn't apply to Hughes. That was the one I got pulled to. So that's why I had to do the last minute preparation. Please prepare more for the one you've applied to, but you will be in a situation where last minute you get pulled to a college you don't know. And that's when you have to be a bit tactful on what you research.
I just add, like, both of you applied when interviews were in person, but this year again, most of them are going to be online, with the exception of Trinity Cambridge, who have decided to do it differently. But yeah, otherwise they're online interviews.
So the next question is, what's the success rate of students getting offers at Oxford or in Cambridge? So as we said, Cambridge is around 12.5% and Oxford is currently around 8.5 to 9%. Now, someone asked, what A-levels did you guys take? So Alec, Grace, what A-levels did you guys do?
So I did maths, chemistry and biology with an AS in geography.
Yep, I did maths, chemistry, biology as well, and I did AS in psychology and also critical thinking. So.
So I'd say you definitely don't have, if you've done 4, brilliant, and my school did not let me do 4 A-levels. So the universities are very aware of this. If you're doing 3, that's fine, just make sure you do well in the 3 that you do.
Exactly, that's the most important part. And okay, somebody asked if you sat exams during the pandemic and got all grade 9s, GCSEs, will Oxford still not look at this? They will, I'm sure, if you have all 9s, will still take into consideration. It's just if the GCSEs have been affected negatively, they would want to see academic growth in the meantime. And the last question is, how did you guys decide whether to, when it comes to applying between Oxford and Cambridge? What differentiated Cambridge for you, Alec?
To be honest, I think the main reason was my brother went to Oxford and I didn't want to just copy him. So if that's something that's important, think about that. I think I liked that Cambridge was a slightly smaller city. When it came down to it, the things that made me decide wasn't about the course. It was more about the life in Cambridge. It was a smaller city. I think it just overall looked nicer. But the courses are just broadly the same. And I think it's an important thing to consider when you are choosing between Oxford and Cambridge, also just choosing any medical school. If you can, go and visit them, and when you're there, think, can I live here? Because it's a long course, and it's not just like, you know, you're going to school and then you get to come home every day. Like it becomes your life then, and so it needs to be somewhere you think you'll be able to feel comfortable and feel happy. And yeah, for me that was Cambridge more than Oxford.
How about you, Grace? Why Oxford?
My answer is a poor one. I hadn't visited either before applying. And I don't know, I had this weird, I guess because I was thinking of applying to natural sciences beforehand, and I did apply, I just switched because I always wanted to do medicine, long story, parents told me not to, and then I realized I wanted to anyway. So it wasn't that I got rejected from natural sciences, I just changed my mind, which they did know at my interviews. I didn't realize they had your past UCAS history, but they do. So if anyone's applied and then changed their mind, they know. I was told by my school they wouldn't, so I was a bit thrown when they were like, we've seen you've rejected all your 4 offers for natural sciences. And why, so that threw me off. But I guess I'd looked into, Oxford don't offer natural sciences, so I'd looked into Cambridge for natural sciences, and I didn't like the fact it was quite, you had to do a bit of physics in first year, and for some reason, even though that's nothing to do with the medical course, I got it in my head that Cambridge is just quite strict that way, which is very much not the case. Oxford and Cambridge are they are the same, but that just gave me a preconception of it. But like as Alex said, the course is the same. If you really want to do philosophy in your 3rd year, that's going to make you choose Cambridge over Oxford. But again, if you can visit, the medical course is a very long one. It is 6 years. And by the time you get to the stage me and Alec are at, I am in Oxford for 48 out of the 52 weeks of the year. If you don't like it here, you will be miserable. So, and I don't mean that in a horrible way, like make sure you're happy. So go and visit and that will help you decide.
All right, so that brings us to the end of the
So
Q&A session.
there was one more question in the chat, which was how should you balance your time when you're preparing for BMAT, but also you've got schoolwork to do?
I think a key one is, if given BMAT is now, obviously you're not approaching important exams. You might be having mocks and things, so obviously do keep like revision ticking over. But the priority definitely needs to be the BMAT. I would say if you're talking about excluding the weekends, if you're talking about like a 5-day working week when you come home in the evenings and do things, 3 evenings to 2 do the BMAT, do other schoolwork, and then on the weekend, again, probably prioritize BMAT. It's only a month away now, so it definitely needs to be your main focus, and then you can catch up on something you might have let slip a bit after that.
Yeah, I'd say similar. I said I only did 3 A levels because I wasn't allowed to do 4. So I had 3 periods at school. They're called 3 periods. It's a lie. Like you do your work from school. So I would do my work then and dedicate an hour every day to doing, like when I got home, doing my homework, and then doing kind of 2 or 3 hours of BMAT each day, Monday to Friday, and then more on a weekend if you can. It is a lot in terms of time management, but you realise as soon as you get to uni, I would give anything to go back and juggle my schoolwork with a BMAT revision because I'd love that. It is just really setting you up to see if you can do both, because you're going to have 3 essays soon with 10 lectures a week and 4 practicals, and they're all due by Friday. So it's just a good practice to be able to do your time management.
And so now I believe we're at the end of our Q&A session. So first of all, thank you everyone for staying and sticking with us. It's around 10:45 right now. So if that doesn't show ambition for Oxbridge, I don't know what will. So can you please, everyone who stayed over this long, can you guys please write if there's any one takeaway that you're going to take away from this webinar in the chat box? What did you learn specifically from this webinar? If there's anything that you're like, you know what, this is going to stick with me, I just kind of figured this thing out. If you can write it in the chat, that would be great. All right, someone said eye contact is crucial. So Grace has mentioned how important that was. Someone said, I really enjoyed the example workshop interviews. Oh, someone says, why we get infections more frequently in the winter? Very interesting. And I like the idea of prompting to get the answer to the question, which is very interesting. Let's wait for a few more. Okay, so I'm not going to bore you guys anymore. I know it's late. I know a lot of you guys have school tomorrow, so I will let you go now. It was a pleasure to explain Oxbridge to all of you guys, and I would like to thank Grace, Alec, and Chris for the webinar as well. So take care, everyone.